question from the audience was about explaining a little bit about gout. And this is actually something I'm very familiar with because I have a client that I work with who's been diagnosed with gout. Gout is absolutely a symptom of dehydration. What you get is a buildup of uric acid in the body, and the kidneys aren't getting enough clean water to wash it through. So, colon hydrotherapy is a hydration therapy, which is why we have such great success with this gentleman. He has really got a hard time remembering to drink his water every day. So how much water do we need? I weigh 150 pounds. I need at least 75 ounces of water a day just to stay even with my cellular activity. So half your weight in ounces is a really good guideline. This guy is like 6'4". He weighs 220 pounds. He's not going to drink 110 ounces of water a day. It's just not going to happen. He's not in that mentality. It's not in his lifestyle. The challenge also becomes, as I work with many elders, they have trouble holding the water in the bladder, so they withhold drinking water so they don't soil themselves or they don't want to wear these Depends. I mean, it's a lack of dignity. It's a great loss in a person's life when they have to begin to wear those kinds of things. So there's big resistance, which means they're just withholding liquid and withholding water. And the liquid that he is drinking is coffee, like a quart a day. It's dehydrating even more, even more. So when we work with this gentleman and he has his colon hydro, which you're going to see in another segment, he takes in huge volumes of water during the colonic treatment because his body is just so dry on the inside. And he can come in here limping because his foot's killing him, and he goes out here dancing. So here's the piece that I want you to understand. How does that happen, that he feels so much better after a colonic? How does that hydration happen? The first job of the large intestine is to absorb water. So if we're drinking water all the way up here, and it has to go from the mouth, down the esophagus, into the stomach, through those 20 to 22 feet of small intestine in the average adult, and then come into the large intestine over here by your appendix, and you're not getting enough, the dehydration occurs in the large intestine. So when we take a speculum and we insert it in the rectum, and we take out the guide, and we have clean water line going in and a waste line going out that connects to this device, this clean water that's going in is affording instant hydration by virtue of this large intestine, whose first job it is to absorb water. When we go to Europe, we're always surprised. 95% of the medications in Europe are given as rectal suppositories. They get absorbed instantly, they do their job quickly, and they cause no gastric upset. When you take a pill from here down, it has to go through all of these other environments and organs before it might actually enter your bloodstream. So this issue of gout is very challenging because it's a lifestyle issue. And Thomas Rowell says it every time I talk to him. God bless my doctor in Switzerland. These are diseases of lifestyle. I don't care if you have arthritis, gout, inflammatory problems. I don't care what you got. It's your gut first that's the problem. I do a good impression of him. I think it's my German background. So when we work with this gentleman and we hydrate him, And he clears the bowel, because if the bowel is loaded with fecal matter, how is the water going to get to the wall to be absorbed? It's just not going to happen. So the feces comes through this tube. It's all contained. There's no odor. We can inspect it. Of course, you know, he had like rabbit pellets coming out of him. That's a first sign of dehydration, is this constipation issue. And of course, he's had that all his life. Now, this is a man who's not going to stop drinking his coffee. And far be it for me to tell him to do so. It's none of my business what he drinks. But he had a wake-up call when I educated him about this dehydration issue. We gave him a gallon of 9.5 pH water, because that will alkalize him. Gout is a condition of too much acid. Too much acid. And these pH papers you can get, we checked his urine before his colonic. This paper didn't change color at all, which means he was very acidic. When he came out of the bathroom and he urinated again, it started to turn green. Can you see the difference?
Yeah.
It was even greener than that. He became alkaline through the colonic by reducing the uric acid in his system and, of course, drinking the pH alkaline water. So gout is definitely a choice. Thank you. Question?
Yes. You asked about what about people without a gallbladder?
Right.
So if you could discuss that.
That's an epidemic now.
So we're going to talk about the question regarding how does the body transition from having a gallbladder to not having a gallbladder. First I want to show you where it is. This is Tommy Torso. He's my buddy. He doesn't talk much, but he's very available to us. The largest internal organ is your liver, right here. It's actually a dark, dark burgundy, the color of beets. So good foods for the liver are red beets. If you look right underneath the liver, you'll see a green organ called the gallbladder. The liver is charged with hundreds and hundreds, probably thousands of functions. It's not just the filter for every pill you've ever taken or toxin you might have eaten, ingested. It's synthesizing hormones. It's just really a busy organ. So therefore, the gallbladder is charged with helping the liver. This substance called bile is created in hepatic cells in the liver, and then it's sent to the gallbladder for storage. So the gallbladder is basically like a sac that stores the bile. We talked about when we eat, while we're chewing, and the stomach gets signaled, the gallbladder gets signaled. That bile leaves the gallbladder, goes into the small intestine, and helps to break down fats and neutralize the acid that's coming out of the stomach, because we need acid in the stomach to break down the food. Think of your stomach as like a blender. It's churning, it's got all these chemicals in there, but primarily acid. So the mouth is alkaline, the stomach is acid, the small intestine is alkaline because of bile from the gallbladder, and then it all turns to acid again in the bowel, the large bowel, because we're dealing with bacteria. We'll talk about that later. Back to the gallbladder. Excuse me. This gallbladder, if it doesn't get enough water, we're back to hydration here, folks. The bile will actually begin to become sludgy instead of more viscous and fluid and able to move out. And as it gets sludgy, it forms what they call stones, gallstones. Now, these little bile ducts are smaller than your pinky finger that take the bile out of the gallbladder. So if one of those stones, which I've seen on an x-ray, is the size of a nickel or a dime, it's not going to get through that bile duct, and it gets stuck and causes that severe pain that people feel called a gallbladder attack. So they rush him to the hospital, which is what they need to do, and they take out the gallbladder. So what happens now? They're still dehydrated. That's how they got in that pickle to begin with. And the doctor says, well, now you can eat anything you want. Some doctors. I'll qualify that. Not Thomas Rowe, and not Bruce Dooley. We have quite a few doctors who are starting to join the ranks and cross over these bridges. So without a gallbladder, the liver doesn't have a helper. So instead of this liver being able to say, okay, thank you, gallbladder, for helping me out today, storing that bile so that when Kim eats the French fries or Nada eats the cheese or whatever it happens to be that's high fat, the gallbladder will be able to do the job, but the liver has to take over that job now. And remember, it's doing all these other things. So Thomas Rao would say your liver is compromised if you don't have a gallbladder. So how do you hang on to your gallbladder? Be good to your gallbladder? Drink pH water, half your body's weight in ounces. Make sure you get hydrated. If you're going to have that cup of coffee, you have to have 2 cups of water to balance the 1 cup of coffee. If you're going to have that 16-ounce can of soda or Bullshot or whatever you like, Mountain Dew, it doesn't matter. They're all junk food as far as I'm concerned. You need 32 ounces of water just to balance out that 16 ounces of soda pop or whatever. So we're back to this whole idea of colon hydrotherapy being beneficial for hydration. If you're not in the habit of drinking, one of my clients gave me a great tip just this week. She said, Cathy, I have taken your advice to heart, and I finally figured out how I can get more water in my body. And I said, please tell me. I have a lecture on Saturday. She said, I set my fancy watch. You can set your fancy phone. You can set your fancy anything. For every hour on the hour, I drink 1 cup, 8 ounces of water. By the end of the day, I've met my quota. And then I'm not up all night urinating, because I was trying to get it all in at the end of the day, and then I would be up all night 4 or 5 times urinating. We're supposed to be resting and repairing at night. So take this tip as a way to stay hydrated. Set your clock every hour on the hour. Have 1 cup of good purified water, which Robbie's going to talk about this afternoon. pH balance, live water, not tap water. I still have clients drinking tap water. The man with gout was drinking tap water. No wonder he didn't want to drink it. It tastes awful. He knew. His body knew as well. So thank you for that question. Anyone else?
Yeah, do you have a little input on gallbladder, liver cleanses?
Gallbladder and liver cleanses are being asked about here. And I would first strongly recommend that anyone who will undertake such a cleanse would have the benefit of a coach, like myself, or another colon hydrotherapist, maybe a nutritionist, a natural doctor. This is something you definitely need guidance with, especially if you've never done it before. My first gallbladder liver cleanse was not pretty. I didn't have a coach. I just read about it and decided I can do it, because that's who I am. And I learned a lot. This is before I got licensed to do massage and colonics, and I learned a lot. So I actually have designed my own liver and gallbladder cleanse, because I've drawn from Thomas Rao, I've drawn from Dr. Moritz, and there's many, many people out there that are writing about this, because it is very valuable for some people. So I think it would be important for me as a professional to say that when someone comes to me, the first time I see them and they say, I want to do a liver and gallbladder cleanse, I would need to be able to take a very detailed health history from them And I would need to be able to walk them through what I call proper preparation for such a cleanse, because it's deeper than just a colon cleanse. And that might take 3 or 4 days, maybe a week, depending on their condition. It's particularly important to speak to the issue of people on medications who want to do a liver and gallbladder cleanse. It's a little tricky. I'm not sure I'd recommend it. It's a good question for Dr. Dooley. So it's just like everything else in my world, it's case by case with the individual. If someone's been doing cleansing for quite a while and they want to just try that next, happy to coach them through that. But it's important that they have some understanding that they need to take time off. They may feel tired. They may get nauseated. They may feel energized, want to go play tennis, come home, paint the walls. I mean, you just never know. You never know with a liver gallbladder cleanse. So it's very much an individual case-by-case situation. And it can be extremely good, especially for someone who is in recovery and coming off alcohol and drug addiction. Because the liver holds everything we ever took that was toxic. Whether it's an aspirin or heroin, doesn't matter, it's in there. So we've actually done some work with people who are in recovery and help them with some gentle cleansing first. Because they're going through a whole new lifestyle, not just with their behaviors, but with their thinking. So it's important to go slowly. That's one of our caveats. Slowly is holy. So thank you for that question. It's a good question.
You had mentioned earlier a formula for your weight and the amount of water use. Could you repeat that?
Mm-hmm. So the guideline for drinking water is being asked about with the question here. And the answer is take your body's weight, cut it in half, and drink that many ounces of water as a minimum per day. So I weigh 150. I need 75 ounces of water just to keep my cells talking to one another. I haven't even talked about the fact that I go to the beach and sweat profusely when I take my long walk. Maybe I need another liter or 2. Thank you for that question about how much water to drink. And it's particularly important in these warm climates where we are here in Florida, or for someone who's a bodybuilder or a construction worker. A manual labor person needs even more than that guideline. So it's a caveat. Thank you. Anyone else?
Well, I was going to say that as I'm getting older, I'm noticing that I'm going to the bathroom more often, urinating. And my rule of thumb is water in, water out. So I go to the bathroom, then I'm drinking water again. And then I also notice that if I'm really working hard, and I can take down, like 16 ounces of water in a heartbeat, and I won't have to go to the bathroom. I mean, I won't urinate for hours and hours. What happens? Where's that water going?
So the question is, I'm drinking all this water and I'm not urinating. Where's it going?
Yeah.
So our body will have different needs for water at different times throughout the day. And another good guideline is to drink the water between meals. Because this stomach of ours really wants to have rich concentrations of acid and pepsin and all the digestive juices. You go into a restaurant, the first thing they do is they pour you a big glass of ice water. That shuts down your digestive fire and dilutes all your enzymes and acid in your stomach. So as soon as I go into a restaurant and they bring the pitcher over, I go, no thank you, I'll take a hot water with lemon, please. And I have 1 little cup of hot water with lemon to stimulate those juices, to make the fire be active in my stomach. So the hydration for each person is going to be different. I would invite you to urine in the bowl. That's a really good indication of where you are. Now, keep in mind that B vitamins will turn it really bright yellow, and sometimes vitamin C as well. But if you're not taking those, or if you want to do an experiment, just stop taking those for 1 day and do some urinating and just take a good look in the bowl. I mean, if it's bright yellow, that's a sign of dehydration. If it's more pale to clear, that means your water is getting where it needs to go. If you're drinking a lot of water and you're not urinating it out, your cells are going, thank you. Oh, I'm getting a nice shower. This feels really, really good. I really need this. Let's talk, let's talk, let's talk. Because cells can only talk when there's ample water. We are a fluid body. We're just like the surface of the earth, 70 to 80% water. So it's a great question. How do you know if you're getting enough? Check the color and check your frequency. Because it's going to be different. I mean, somebody said, well, how many times a day should I urinate? I don't know. It's like saying, how many times a day should I defecate? I don't know that either. But you're an expert. No, it depends on so many things. Not the least of which is the connection of your second brain to your head brain. Can you relax? Are you breathing? Are you able to sit quietly in the bathroom and let things happen? Or you just get in there, push, and try to get out of there as fast as you can. It's an inconvenience for a lot of people to urinate and defecate. So this is the mindset that is really challenging in the care and feeding of a human body. How do we love ourselves enough to really honor those signals and go when we need to go? Thank you.
I've got one more question.
Good.
Sorry, I'm always the one that asks a million questions.
Questions are good.
But the liver, okay, and you said that the liver has a lot of functions, hundreds, thousands of functions, and I understand that. And Lindsay's been helping me come off of very bad sickness about 3 months ago.
Wow.
And so, of course, I was taking all these pills,
Yeah.
and they're still in my liver.
Yes. They are. Yeah. I can feel that.
How long does it
It's a
take to
lot.
get them out?
I wish I could answer that. If I had a crystal ball, Kim, I would tell you the answer. There's so many contributing factors to helping yourself to take care of that. There are some herbs that will protect your liver. One of them is milk thistle. I'm not prescribing, I'm not diagnosing, I'm simply saying you may want to look up on the internet and see if milk thistle speaks to you as an herb for protection. There's another herb that's extremely wonderful for gentle beginning liver cleansing, and that is dandelion, and the tea is available to you if you want to drink that today. I drink 1 or 2 cups of dandelion tea every week.
Okay.
It's just, once a week I just pay attention and make a commitment to do a gentle cleanse. I may not have a colonic, but I'm all vegetarian for those 2 days. I'm reducing my input of food in general, drinking more dandelion tea, having my beets. You can grate them, make a beet salad.
I love beets.
If I were you, I'd be eating beets every day.
Yeah, I love roasting them.
Roasted
Putting them
beets
in
are
the
great,
salads.
raw beets, any way you like, any way you like.
You can eat the greens too, can't you?
Excellent.
Yeah.
Excellent. Steam them, saute them, whatever, or juice them, or put them in the blender. When I do the beet smoothie that's out front with raspberry, I did the whole beet and the greens. Yeah, get as much of the plant as you can. And then, if you're working with Lindsay, I know you already know this, you can talk to your liver. Make a relationship with your liver. Make a loving, tender relationship with your liver. Just lay your hands on your liver. Enjoy your liver. One of the most beautiful things is, as we close this segment, we are constantly regenerating. We are constantly dying and constantly being reborn at the cellular level. So whatever we can do to encourage this regenerative activity, whether it's infrared or relaxation, dancing, music, joyfulness, clean water, there's so many ways we can love ourselves. Trust in your body's ability to rejuvenate and regenerate, because that's the strongest urge we have. Thank you.